Steve Show to bring you the latest information about procedures that have signs of it. Well, in today's edition, we're about incredible, which reads the skin to know it's a eat. And with me now, it works is Diamond and Pete. Janice, coming in, ladies. And tell me what makes it so many other lasers.
Sure. So this is a combination. That's what we're combining to Sublime, specifically for deeper part skin. Sublative, more that thing of the fine line, wrinkling, and putting these together, overall, she'll rejuvenate.
So basically, deep and on the surface, give you a great. See how it works. I know Jane over here.
This is specific deep heating, the target laxity. Here we go.
Now, when you're getting Janice, do you
feel it's not a
well, because you're hard.
Right, but you like almost pulse.
And once you do the whole area with this is all done.
You can do it together. You can actually do it if you choose. We'll move to this piece, and this ablative.
This does the ring superficial part.
So this targets a bit more super skin, again, for lines, ring, texture. Sometimes use it for scars and even on the body.
How many treatments usually need done before you see results?
You will see results even first, or two, but it's about 6 weeks apart.
Okay, let's give it a shot.
Okay, just a bit towards.
So again, the same kind of where you're moving along this, like looking, seeing the lights hurt. When you do this, more uncomfortable?
Comfortably.
So do you use this to any kind of event? Does that work?
When I do a treatment, I do local anesthetic cooling mechanism that the patients.
Give me a shot. Feel it. 1 to 10. What it feels like?
For patients, it's maybe 2 or 3.
Yeah, that's what I feel. It feels like a little zap, but it pains on your pain threshold. How you feel it?
And here, we used any timing or any mechanism.
Like something like.
It's where you live during your treatment, you'll see $800.
And a period of time before you see results.
There is along the way. It does take months for call to develop show results, so through your final.
All right, so anyone should not on any patient can, and you're just for this procedure.
So it would really has affection, who has egg. I want to treat an overload condition.
Dr. Brightman and Jeff for coming in. I think I need to get a tightening. Looking a little, yeah. Who doesn't?